In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Taskforce for Combating Coronavirus, His Excellency Dr. Walid Al-Mana, Undersecretary of the Ministry of Health, Lieutenant Colonel Dr. Manaf Al-Qahtani, Infectious Disease Consultant at the BDF Hospital, and Dr. Jamil Al-Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, we begin with Dr. Walid Al-Mana, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within His knowledge. Praise be to Him for His countless blessings and grace. And praise be to the Prophet. We would like to welcome you to this press conference to inform you on the most recent developments, and we assure you that the paths to dealing with the COVID-19 will continue according to the plans until we achieve the desired goals. And in light of the discovery of the new variant Omicron in a number of the countries around the world, we confirm that the National Medical Taskforce and the parties concerned are constantly following up on global developments regarding COVID-19 and its variants. And we confirm that all the parties concerned and implementation of the directives of the Council of Ministers and the Executive Committee will not hesitate to take the necessary measures at the local level to protect the citizens and residents of the kingdom. And we shall also commend the responsible spirit shown by the citizens and residents through their commitment to the precautionary measures, which resulted in a remarkable improvement in the existing daily cases. And in order to preserve the progress and the achievements, we stress the importance of continuing to follow all the precautionary measures and to take the initiative to take the vaccines and the booster dose. And again, we warn against falling into the false sense of security and the consequences and maybe neglecting the precautionary measures. So it is rather the responsibility of everyone to continue with determination through full adherence to the precautionary measures and to continue registering for the vaccines in order to contribute to achieving the desired goals. And following the approval of the Executive Committee and based on the latest developments, it was decided to update the booster dose protocol for the vaccinated and the recovered by reducing the period of taking the booster dose, and those who received the virus BioNTech, COVID-Shield, and Sputnik vaccines for those 18 years old and above from 6 months to 3 months, and also to reduce 1 year to 6 months of recovery. And Lieutenant Colonel Dr. Manaf Al-Qahtani will explain the details further. And to conclude, hand in hand, we will continue to maintain the health and safety of everyone. Now leave the floor to Lieutenant Colonel Dr. Manaf Al-Qahtani. Please proceed. Thank you very much, Dr. Walid Al-Mana. In the name of God, most gracious, most merciful, good afternoon, everyone. Well, there is no doubt that for over 2 years, we've seen the variants that they were continuing, and they will continue unless there is a high percentage of the global population taking the vaccines. And we also emphasized many times that those viruses and variants have nothing to related to a country, race, and not, a theory. It's about the behavior of humans. We are the reasons for the variants. Unless there is a high percentage of the community took the vaccine. So the question will be always, what is the rate of the infectious of the active cases and the death rates in order to realize the importance of the vaccines and the booster doses in order to get out safely of the pandemic. So as mentioned by Dr. Walid Al-Mana, since the beginning of the taking the vaccines and since May 2020, we analyzed all the data for those who took the booster doses of all the types, and based on this, on these data, it has been decided to reduce the period for the booster dose Cough Shield, AstraZeneca, Sputnik, and Pfizer. Instead of 6 months, there'll be 3 months, according to the local statistics and data we have, which confirmed that this is important as a proactive measure and to enhance the immunity, including Omicron. So the period was reduced for those took the vaccines from 6 months to 3 months of the last one, and as a notification to take the booster dose for the recovered, the period was reduced from 1 year to 6 months. And this was based on many data that we analyzed. So we found that those recovered, they are eligible to take the booster dose, and as a precautionary measure, the period was reduced from 1 year to 6 months. And as a notification to take the booster dose, the color of the logo in the Be Aware application will automatically change to yellow starting from today, the 1st of December 2021, and it will go back to the color green after taking the booster dose. So I call upon all those eligible to visit any of the health centers announced by the Ministry of Health without the need for a prior appointment. And we stress that all the decisions taken regarding vaccines and booster doses, they came in accordance with the latest developments and studies, and in addition to the latest global studies. And we've seen that some countries around the world already advised their citizens to take the vaccines and booster doses. And we stress the importance of continuing implementing all the precautionary and preventive measures announced in a way that would contribute to limiting the spread of the virus in order to safeguard the health and safety of citizens and residents. And to conclude, we reiterate that your responsible awareness is the basis for the success of the national efforts, and therefore we count on it to hopefully eliminate the virus. So protection is much better than cure. So I'll leave the floor to Dr. Jamila Salman. In the name of God, most gracious, most merciful, welcome again to this press conference in which we would like to emphasize certain points: implementing all the precautionary measures, taking the vaccine and the booster doses. Studies for 1 year and above, we've seen that the active cases showed the importance of taking the vaccines and the booster doses because they contributed to limiting the spread of the virus and alleviating the symptoms and complications. And this is important for everyone because the vaccines and the booster doses plays an important role in fighting variants. And we should realize this by enhancing our sense of responsibility to take the vaccines and booster doses immediately. And we urge parents to take the initiatives to register their kids. And we thank those who took the initiatives because they realize the importance of the vaccines in order to preserve the health of their kids and protect them from the virus and its variants. And we also emphasize the importance of taking the precautionary and preventive measures, including social distancing, wearing masks. They are very, very important, whether from this virus or its variants. And I'd like to thank everyone for the results that we've achieved so far because of the awareness and commitment of everyone that they showed throughout the course of dealing with the pandemic. So it's necessary to continue with the same determination to take the vaccines and the booster doses. And we stress the importance of adhering to the precautionary measures and the decisions in order to safeguard the health and safety of everyone. And to conclude, we wish you health and safety, and that hopefully the next stage, with the solidarity of everyone, will continue with the same determination to have the progress in reducing the active cases. Thank you. Thank you very much, the speakers, for the briefs. Now we'll take the questions from the journalists who are following us remotely. First, Al-Biladi newspaper, Ali Al-Muhafda to Dr. Walid Al-Mana. After detecting the first Omicron variant in the Kingdom of Saudi Arabia, in addition to its spread in European countries, what are the precautionary measures to be implemented to protect the borders of the Kingdom of Bahrain? Thank you for the question. Just to emphasize that the Kingdom of Bahrain is taking measures and actions from the beginning of the virus. So regardless of the variant, well, there is prepared, we're ready for that. As there are two important things. The strategy of Bahrain in detecting and treatment the virus from the beginning. So we have the testing, really important. We're conducting tests at a higher percentage, including the borders and inside Bahrain. So we're still having testing after 5 days and 10 days. It did not change. So we're having the same tool before detecting the virus. And after the testing, we have the trace. And so Bahrain, we have a great percentage of tracing the contacts and also the variants. So we're testing all those people who got positive. We test them in the lab and we make sure the sequences of and Bahrain has all the variants followed up. And for the treatment, in the treatment team, we have Dr. Manaf and Dr. Jamila. We have a very successful treatment protocol. We have the monoclonal using the antibodies. It has radically changed the system and method. And as for the vaccines, a number of countries are recommending using the booster dose, and Bahrain, since May, we started taking the booster doses. So any variants we have, the National Medical Taskforce, thankfully, they have great efforts in implementing the precautionary measures. So with any variants, thank God, we have the precautionary measures existing. Question to Dr. Manaf Al-Qahtani from Ayman Shakl, Al-Watan newspaper. Will the 3 booster doses be sufficient for the new variant, or there will be a new booster dose to be announced. And will Bahrain need to buy new booster doses? Well, thank you. We have two parts. As for the first part, the booster doses, the 3 ones, well, just to let you know, we have a team specialized in conducting researches and studies. And when assessing this, it's not just the number of booster doses, but also the period. So, including the data, it showed that it's important to reduce the period between the second and third booster doses in order to increase the numbers of those taking the third booster dose. So before taking the 4th booster dose, it's important to reduce the period for those eligible for the 3rd booster dose, including Pfizer, AstraZeneca, and Sputnik, and also those from 1 year to 6 months. This is a precautionary step for the variants. And as for the 4th booster dose, we don't have a need so far, but once we complete the studies, we will keep you posted. As for the second part, purchasing the booster doses, we have different sub-teams. We have one team who is in charge of following up the global vaccines, and they are in contact with all the companies, and so far the vaccines we have are sufficient. But once we have a new one, trust me, we're going to contact them and we will be among the top countries to purchase them. A question to Dr. Jamila Salman from Tamam Busafi Al-Ayyam newspaper. With the new discovery of the variant in the Northern Africa, there was a media about, reducing the trust of the variants of the booster doses and spreading the horror. So is this discourse real? And if this is real, what are our measures once this variant comes to the Middle East? Because it's just a matter of time. Thank you. This is a very important question. To answer the first part, was this real? No, this is not real. The initial data about the Omicron, maybe the most important things we need to know about are these ones related. Is the variant really like more than the previous ones? No, it is not we don't have data that shows it is severe. And as for the media, does it spread quicker? Well, we don't have any confirmation and it was not confirmed. The third part, are the vaccines available and adapted, whether in the Kingdom of Bahrain or globally, are they efficient on this, against this variant? Well, there are existing studies to study the effectiveness of these vaccines, and all the studies that all of these vaccines are efficient. Well, the degree of the efficient varies. As for the fourth part, can the PCR detect them? Yes, it is effective and it can detect that this new variant is there or not. So all of these are initial information and we'll update you once we have more information. But most importantly, what can we do from the beginning with all the variants of the virus that we faced? The most basic things are basic, they are effective, they will reduce the spread of and complications and death rates of the virus. The precautionary measures, wearing masks, social distancing, they are really important in reducing the variants, or that will be taking the vaccines as well. and the booster doses, because they really contribute in enhancing the immunity and reducing the complications, and most importantly, related to the question, the information should be taken from reliable sources that are scientific and not any other ones. Now I go back to Dr. Manaf from Akhbar al-Khalij newspaper, Fatima Ali. Will the task force reconsider the immunity, taking the immunity with taking the new variants, and do they really don't need to take the vaccines, taking the, depending on the level of the immunity between one person to another? Well, first, as we announced today, after the analysis of the local data, we reduced the period from 12 months to 6 months for those recovered based on the analysis. And in fact, we mentioned many times for 2 years from the beginning of the pandemic, the immunity of those recovered is not enough because there are variants, and we need the booster doses to enhance this immunity. So with the pandemic, the only thing would be taking the booster doses to also limit the period of taking the vaccines. Dr. Jamila Salman from Mahmoud Rafiq, the 24/7 News. Why the latest 48 hours witnessed what he calls a surprised rise of the active cases, and do those who took the vaccines need to take the booster dose? Thank you for the question. You have two parts of the question. As for the rise of the active cases, the way of the Kingdom of Bahrain, the National Medical Taskforce, we're conducting a large number of tests. And whenever you witness an increase a day or two, as you know, we have the green light, we have the average of the active cases within a period of time and not just a day. But it's important as a question because we mentioned and we repeated, and it has to be clear, any reduction or decrease in the active cases is due to the solidarity of everyone in implementing all the precautionary measures and taking the booster doses and the vaccines. And any increase of these would be due to the reluctance of taking the precautionary measures. And that's why we encourage everyone to continue within the same determination, the same efforts in implementing these precautionary measures because they are effective. As for the second part, with the decisions, yes, taking the booster doses will contribute to enhancing the immunity and combating the virus and their symptoms, and also reducing the death rates. Question to Dr. Walid Al-Mana from Pradeep, Gulf Daily News, and 4 p.m. News. The World Health Organization expressed its concerns that some countries are conducting comprehensive efforts against Omicron, and which might not be unfair. So would Bahrain reconsider some of their decisions? Well, just to clarify that the Kingdom of Bahrain has its own methodology of the red system, and we've included some countries from the east and west according to the risk that would come from those countries. And we have a number of elements to assess the risks. So what Bahrain has done is an activation of a previous list, and we included those countries due to the risk of having those variants. Yet we have limited information about this variant, Omicron, it could be or it could be not. We will find out over the coming period of time. But let me go back. Generally, it's not, it's not like picking certain countries or, it's rather assessing the risk in any place of the country, and every country has the right to preserve the security and protect their citizens and residents. So we have a methodology and we did not change it, what we call the red list, and we just activate it, and we might add any other country that might impose a risk on Bahrain. So that's it. Thank you. So now we conclude the question and answer section. Thank you very much to the speakers for your briefs and for answering the questions, and also thanks to the journalists and reporters and you, ladies and gentlemen, for listening and watching. Before concluding, kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. To conclude, we wish all Bahraini women success in the contribution of the sustainable development. Thank you very much.